Hello everybody, thanks for tuning in. My name is Ishbel Correa Narvaez. I am the program coordinator for the Health Equity, Diversity and Inclusion Office at Albany Med. Today I am here with SNMA's president and vice president. So we have Mehedet Mekonnen and Oni Weekend. To get started, can y'all tell me more about your student organization?
We are the chapter SNMA, so Student National Medical Association, chapter of Albany. Our purpose is to essentially better integrate students into medical school, specifically underrepresented students. Make them just feel more comfortable, make them feel relaxed, supported, and overall just a better position for them to thrive in. It's very easy to feel out of place coming into medical school sometimes as a minority. So we definitely try our best to integrate them as best as possible. And we also do our best to serve the underserved populations around Albany and, really try to achieve equity by advocating for those populations.
Perfect, thank you. What population do you serve and how do you serve this population?
So historically, we have served Black, Latinx, and Native American students who are essentially underrepresented in medicine. So we ultimately serve them on a both national and regional and local level as well. So it's on different aspects in terms of academic support through mentorship and being able to ensure that they have that support with the different interest groups that we have through SNMA. So essentially every specialty has a respective interest group that students are able to understand what the journey is like and so on. In addition to that, there are faculty advisors for SMA as well. But on a local level, we're able to support our students through an academic setting in the sense of by partnering with LMSA, we have been able to provide mentors for the 41 incoming URIM students. So that is able to provide them with the advice that they need for the themes that they're going into at Albany Medical College specifically. But in addition to that, we're able to support them in a more social setting as well by organizing events and so on that is able to build a sense of community as they venture through an environment that may be new to them and get through it.
Nice, thank you. Are there any recurring programs that you wish to highlight, and what is the purpose and goals of those programs?
Yeah, so some recurring programs that we wish to highlight would be our annual sickle cell walk. Every semester we have at least one community service event. So last semester was our sickle cell walk, and this semester will be our health fair. In our sickle cell walk, essentially the goal is to raise awareness for sickle cell, garner community involvement, gain money for research and treatment. Actually, I did a research where sickle cell and cystic fibrosis are essentially like two of the same diseases. However, they affect different populations. Cystic fibrosis affects primarily Caucasian population, and sickle cell affects primarily African American populations. But the federal funding for sickle cell is way less than cystic fibrosis. So we actually are doing a job to mitigate that disparity and gain funding for sickle cell research and treatment. And as far as our health fair, which we're having this semester, that's essentially to provide health education to the underserved population, to do basic health screenings, and answer any questions or concerns that everybody has health questions and concerns. So if we could do our best to answer any possible concerns, that's what we're here for.
Nice. And this health fair occurs every year as well?
This will essentially kind of be our first one this year.
The inaugural.
And yeah, hopefully we can keep that going throughout the years.
But the past sickle cell walk that we had, it was the second annual one for which we were able to raise over $3,000. And we had, it was absolutely amazing. And we had over 80 people come out and support from various organizations such as Phi Beta Sigma, Delta Sigma Theta, Albany Medical Alumni Association as well. So it was an amazing way for us to get the Albany medical community involved, but in addition to other community organizations and being able to interact with the Albany community in and of itself as well to raise funds.
And address health disparities as well.
Yeah.
And just to clarify, the health fair is for community members, right? Patients, potentially students, like who is your targeted audience for that?
So first off, it'll be taking place on March 26th, but we will primarily be servicing the vulnerable population in Albany. So we're hosting it at Capital City Rescue Mission, which serves primarily homeless populations or houseless populations. So we're hoping to have potentially vaccinations, screenings, and so on, but also being able to connect them with the service learning programs that we have at Albany Medical College, and being able to provide even non-medical services as well, such as transportation and so on. So ultimately, we're trying to help folks who may not have that quality of care or that ease of access due to whatever barriers that they may have due to social determinants of health and so on.
Nice, thank you. So how has SNMA helped you individually?
Me personally, I would say SNMA helped me in just gaining more insight onto the community struggles, which I feel like, will better help me when I'm a future physician myself, knowing just the struggles that the community has. I think it's very important to know what your population is dealing with so you can have a better understanding of how to treat them. I think it just helped me to have a better relationship with my peers, build camaraderie and a support system that we could have on for the rest of our medical career. And ultimately, I think it's also just helped me to be more clinically knowledgeable. We've had a lot of different panels about different specialties, from otolaryngology, dermatology, radiology, and other different specialties. So I think all in all, it's just been helping me to gain more clinical awareness and knowledge.
Thank you.
For me, I feel like it has been a way for me to find a sense of a community. Med school is definitely an arduous process, so to be amongst folks who are like-minded, who ultimately want to be as culturally competent and socially conscious future physicians, I have been amazed at how all of my fellow peers have been driven in their sense of purpose, but also embodying SNMA's mission in our everyday lives and how we communicate with each other in our sense of knowledge as well. In addition, we've been able to share a lot of resources with each other that I feel like we would not have had access to without SNMA and without that sense of bond that we currently have.
Thank you. Where do you see SNMA going in terms of growth here at Albany Medical College?
Personally, I see us, being able to get even more community outreach, and I think we could do such by, collaborating with even more different diversity groups around the AMC, and I just ultimately want us to have more clinically aware students and more socially competent students, and creating a space where every student that comes in that's underrepresented feels safe and secure and more supported.
Thank you.
And I also hope to see SNMA growing in the sense of branching outside of just the students at Albany Medical College, so being able to involve faculty, residents, attendings, and just providers at Albany Medical Center, in the sense that there are a lot of individuals who share identities and experiences with current chapter members of SNMA, and we hope to establish a sense of mentorship, but also involvement with folks who are around Albany Medical Center and grow that as well. So we have a clinical liaison position that we're hoping to develop and grow over the years.
Thank you. And what are some ways in which those that are at Albany Med are able to support you? So from faculty advisors to general clinicians, staff.
One of the greatest ways would be able to show out at our events, essentially, in the sense of the sickle cell walk and the upcoming health fair that we have, having a sense of contribution in any capacity from Albany Medical Center. That doesn't necessarily mean just financially, but also in terms of support would be absolutely amazing. We have felt that support through OHEDI, and we hope to grow that more as well through the rest of Albany Medical Center.
Nice, thank you. So that's all the questions I have for today. Thank y'all so much for joining me. My name's Ishbel Correa.
Well, thank you.
I love that. Please include it.